unfortunately in a very symbolic period for all Europe, for all the world, but also for Greece, all these phenomena which have to do with the climate crisis, of course, are leading us to understand how all these issues are related to health, of course, and to public health.
The International Association of Health Policy is a scientific, political and cultural organization. It is an international network of scholars, health workers and activists with an aim of promoting the scientific analysis of public health and a forum for international comparisons and debate on health policy issues.
It is the tradition and the political choice of our association organizing activities without dependence on donor relationships and through solidarity. We are proud of our association.
Si las cosas que uno quiere se pudieran alcanzar, un amor que se nos va es un pedazo del alma que se arranca sin piedad. Es un pedazo del alma que se arranca sin piedad.
We decided to organize this conference because the pandemic damaged a lot our societies, and we have lost many human beings' lives in spite of we had the choices of prevent them. Especially the vaccines were invented, but we couldn't prevent the avoidable deaths occurred, unfortunately.
Humanity invented the vaccine, but in order to be able to access to the vaccine, there are some political, economic, social and cultural determinants or barriers.
If we talk about political economy of trade, and that's the frame I want to use in getting around the vaccine issue.
So trade agreements and the impact that they have on intellectual property rights and the impact they have on access to vaccines really needs to be understood as an outcome of a very disequalizing kind of a global capitalist economy. So fundamentally we need to transform that economy. That form of economic system is not only denying us kind of access to medical goods for those who don't have a lot of money, but it's also through fossil fuels and climate change and resource exploitation. It's basically killing us.
Εγώ προσωπώ την International Center for the Prevention of Nuclear War, που είναι μια οργάνωση γιατρών που τιμήθηκε με Νόμπελ Ειρήνης το 1985, διότι ήταν η πρώτη που είπε στο κοινό ότι σε περίπτωση πυρηνικού πολέμου η ιατρική να μην μπορεί να αντιδράσει. Σήμερα δυστυχώς ο πόλεμος στην Ουκρανία επανέφερε το πρόβλημα των πυρηνικών στην πρώτη σελίδα. Πρέπει εδώ να πούμε ότι κανένα πυρηνικό πια δεν είναι μικρό. Η εταιρεία μας έχει κάνει έρευνα και έχει δει ότι και με χρήση μόνο μικρού πυρηνικού οπλοστασίου είναι δυνατόν να γίνει κλιματική αλλαγή που να κάνει παγκόσμια πείνα, λοιμό παγκόσμιο λόγω της κλιματικής αλλαγής που θα προκαλέσει, που να έχει θύματα 2,5 δισεκατομμύρια ανθρώπους σε όλο τον κόσμο. Άρα δεν μπορούμε να μιλάμε για περιορισμένο πυρηνικό πόλεμο. Και γι' αυτό βεβαίως εμείς σαν γιατροί εξακολουθούμε και κάνουμε ενέργειες και μέσω του ΟΕΕ προσπαθώντας να πείσουμε ότι αυτές οι ζώνες πρέπει να μην υπάρχουν, αλλά η μόνη λύση θα έπρεπε να είναι το σταμάτημα των πυρηνικών εργοστασίων. Να μην φτιάχνουμε πια καινούργια πυρηνικά εργοστάσια αφού δεν μπορούμε, λέμε, να κλείσουμε τα ήδη υπάρχοντα. Και βεβαίως να πρέπει να υπογραμμίσουμε ότι μέσα σε αυτό το χαμό βλέπουμε ότι το πυρηνικό λόμπι προωθεί τα πυρηνικά εργοστάσια, ότι δήθεν είναι η λύση για την κλιματική αλλαγή και λέει ότι πρέπει να φτιάξουμε περισσότερα. Αυτό δεν ισχύει. Διότι, όπως ξέρουμε, μια κατασκευή πυρηνικού εργαστασίου θέλει 30 χρόνια, οπότε η κλιματική κρίση ήδη θα έχει φτάσει εδώ. Επίσης, δεν πρέπει να ξεχνάμε ότι τα πυρηνικά εργοστάσια χρειάζονται πάρα πολύ νερό, το οποίο ξέρουμε ότι σε συνθήκες περιβαλλοντικής κρίσης θα είναι πολύ λίγο. Και είδαμε ότι η Γαλλία πριν από λίγο είχε κλείσει λόγω του καύσων τα πυρηνικά της εργοστάσια, γι' αυτό ακριβώς το λόγο. Άρα δεν είναι η λύση όπως διατείνονται. Θα πρέπει η ανθρωπότητα να σκεφτεί άλλες λύσεις, αλλά κυρίως θα πρέπει να προλάβουμε να μην οι ίδιοι αυτοκαταστραφούμε από χρήση πυρηνικών όπλων.
That put simply just says that human health and the health of the planet should go together. We cannot focus on
Capitalism is the root cause of all the things that we are discussing here in this conference, because it is damaging the environment, it is damaging the human lives, it is damaging the species, and without discussing without putting the framework with the capitalism, we cannot make a comprehensive discussion, and we cannot create solutions, and we cannot build the struggle on.
So I've been working for 20 years on looking at healthcare privatisation, not just in the UK, but globally. I've done a lot of work for trade unions and really looking at the impact of privatisation on the quality of public services. One of the things I've noticed over time has been the growth of private equity investment in healthcare. As one of the goals of private equity is to get good returns, and so the companies are more interested in the returns than on delivering quality public services. This is something that we need to think about in the future, and really how we can reclaim and make more public our public healthcare services.
What I want to talk about today really is a trend that we've started to observe for a number of years within the UK healthcare system, which we're framing slightly differently in terms of the debate about the privatisation of healthcare services in the UK that Jane has spoken about.
So the impact of the growth of the for-profit sector in the UK is twofold really. One is that there are increasing pressures from the for-profit healthcare sector to take revenues away from the NHS and to move them towards their shareholders and investors. And secondly, there is a move as well for patients who are unwilling or unable to wait for NHS care because we have very long waiting lists to have to pay for healthcare themselves. So we're seeing two trends come together really. We're seeing the growth of the for-profit sector, which has been supported through government subsidies over the last 20 years, at the same time as we're seeing a contraction in the amount of money which is going into the state-funded, state-provided healthcare service, which means that then you've got more people who are going to the growing for-profit private sector for their care. And the consequence of that over time is that because it's often the middle classes who are having to pay out of their own pocket for healthcare because it's not available on the NHS, that they become disenchanted with the NHS and therefore they become less willing over time to pay more tax to fund the NHS, which then causes the problem to become more acute. And the potential risk is that the NHS becomes a service which is just for poor people, and that you have a parallel system which is people paying through their own pocket or through private medical insurance, and that the NHS, because it is for poor people, becomes a poor service.
dolphins, but there's also other species involved. And one of the important things to remember is that the entire life course of these animals, from offspring to adulthood, slaughter and packaging, happen within generally unsanitary, dangerous factory conditions.
In terms of preventing the next pandemic, the socioeconomic system is really dysfunctional. I call it a pandemic machine because it's driving all factors that are responsible for pandemics, such as deforestation, intensification of animal farming and animal agriculture, urbanization, climate change. These are the key factors that increase risk for viruses. But behind all these factors, there is a dysfunctional socioeconomic system which is trying to aim at perpetual economic growth, which is obviously an impossibility, and is based on the idea that markets know best and they can regulate themselves. When in reality we need some guidance from states and government and democratic institutions in order to make sure that this economic system is accountable to the people.
I participated in this conference in order to talk about the context of Palestinian daily life and the effect of the occupation on our health status and healthcare system. And we concluded that the prolonged colonization and occupation of Israeli to Palestinian land, and the same time prolonged blockade on Gaza Strip, having very harsh measures like building the wall, separate the families, separate the community from each other, and make the access to health is difficult. We're talking about more than 600 checkpoints inside the city, between cities and villages. This is really a traumatic experience for Palestinians and mainly for ambulances and for health workers who are going to their work in the morning. Always they have been delayed because of these checkpoints. So there is a lot of suffer. The element of social of the rights and social determinants are not well tackled. Mainly what we are talking about, the availability, accessibility, affordability, that are not well addressed because of the political context and because of the occupation that we face and their practices against people that resulted with very weak health outcome at the level in general. To improve the situation, yes, we need solidarity, more support, but the root causes of this problem is the occupation, so the message is to end the occupation.
Originally, I'm a human rights activist and I work with the human rights violation cases as a forensic physician to document human rights violations. So as a part of my work, particularly, the governments do not approve my words at all because I just confront them with their crimes since human rights violations are committed by states. Of course, with the situation in the country, human rights violations are escalating everywhere, in every instance, and particularly the professional organizations, such kind of institutions also are wanted to be destroyed. Or at least devalued, criminalized. For many years, many years, many of our colleagues from these professional organizations and human rights organizations are criminalized, sent to prison, arrested and detained for a period with several court cases against them.
My thanks to the organizing committee for the opportunity to share some of our experience and very especially
We need to keep working on that much bigger struggle to transform our political economies into something which is based more on notions of well-being, health, on equity and justice, and on sustainability. We need different political economies.
This is the reason why we organized this conference, bringing together all the people, sharing experiences and inspiring from each other's struggles and build a collective struggle upon it.
I think that we all agree that this has been a fascinating, exciting meeting of important people. But in order for us to be able to materialize this, we do a lot of colleagues, friends and comrades have been working behind the scenes. Members of the IAHPE Conference, the organization of this conference. Last but not least, so if to take the photo of the conference. No? Yes. Yes. The solidarity conference.
John!